What does it take to strengthen health systems? It takes science, commitment, and leadership. And where I sit at IDRC, what that means for the Governance and Equity in Health Systems program is about enabling, fostering, networking, brokering, engaging with people from on the local level to national level to global level to strengthen health systems. For example, one of the projects that we support is looking at the issues of financing, and you would think with financing, that's a core component of strengthening health systems. But what's different or unique about this research that we support is it's looking at financing in vis-a-vis looking at access issues, because you can't separate different components of any system. And so we have researchers in Africa, Asia, and Latin America who are looking at from a very technical methodological point of how do you actually get the taxation working to strengthen health systems so that all people have access to health care. So beyond the financing, and one of the important things is that to strengthen health systems, you also have to be able to understand what is the root of the problem. And the researchers that we work with, for example, when you're looking at maternal health issue, it's not just about not having emergency obstetrics care, but it's a much more profound problem about the role of women vis-a-vis in their status in society. So we have researchers examining this using strong science and linking that to actual change in policies and practice. Also, another part of strengthening, and where I think this is where IDRC comes in and really quite important, is being able to support evidence and science that is of high quality, that is used, and that can make a difference. An example of a project that's dealing with this is our work with the Government of Nigeria and the Canadian International Development Agency. Early in the project, we had a really quick win where the evidence was used to actually close the gap between what people were paying to what they actually should be paying, which is free, nothing. And so that a commissioner saw the evidence, and he came in, this is where the leadership comes in and the commitment, and said, this is not going to happen anymore. But you need to go one step further, and this is where IDRC comes in enabling and supporting not just researchers, but decision makers to go beyond actually one-time change to a much more long-term change. And that's about capacity strengthening. It's about getting people the confidence, the sense of ownership, the sense of ability and the skills and the know-how to actually take the evidence and change policies and change where resources are going. About 2 months ago, I saw a health commissioner. He was doing a presentation and he had a slide of 5 indicators. And he said very clearly, he said, these 2 indicators I can't do anything about, it's politics. These 3 I can do something about, and this is what I can't do about it. To have a health commissioner in a state where you have maternal mortality rates at around 900 per 100,000, to say, this is what I'm going to do, and you can see it in his eyes, is what's going to make the difference. And then on top of it, I find out later, not only because he's got that capacity, he is taking that leadership, he understands and is ready to make that change. He's also bringing other people on. And so he's got directors who have degrees from northern countries coming back to work in communities, their own countries' places of birth. And that's sustainability. That is what's going to strengthen health systems.